Hello, my name is Tony Young. I am a consultant surgeon in the National Health Service in England. I am the Associate Medical Director for my region in Essex around innovation and transformation. I'm the Chair and Director of Medical Innovation at Anglia Ruskin University, but I'm also the National Clinical Lead for Innovation for the Health Service in NHS England. So that makes me a clinician who has a leadership role for a whole nation's healthcare innovation. And that was one of the key points we were getting across in the talk I've just given today at this fantastic conference in Rome, is looking at what we're doing in the world's largest unified healthcare system, the NHS, around innovation. How are we producing the right government policy, the right structures and systems within our healthcare service to allow frontline clinicians to test and trial new things and to take them up. I spoke about our Accelerated Access Collaborative. So this is an organisation that has been established to look at the barriers, to look at the problems to taking up innovation right at the top of government and say, actually, we want these innovations to be taken up. They are proven to be cost effective, so they produce healthcare efficiency, they produce higher quality, they improve patient care and outcomes, but for some reason so far they've not been taken up right across our system. In one or two places, we're going to change that. And I outlined the structure of the systems we've put in place and gave some fantastic examples of how the processes, the procedures we've now put in place to create an innovation culture are allowing our nation to adopt the latest in healthcare technology and advances more rapidly than I think anywhere else on the planet. We looked at the example of HeartFlow from Stanford University, an artificial intelligence algorithm that predicts whether you will benefit from a coronary artery stent. We've gone from a year ago with no adoption of this technology across our nation to a year down the line, exponentially rising. More than 2,000 cases in the last quarter were now done across our nation with that. Over a third of units in the country are now using that. We're hoping more and more, and we're encouraging more centres to take that up. And I'm hoping within the next 2 or 3 years, all centres in the United Kingdom will have gone from a technology that was really promising and good that they weren't using to something that is part of standard clinical practice. And I think that is the leading example of a nation taking up artificial intelligence technology in healthcare right across its system. I also spoke about our clinical entrepreneur program. Wow, we have empowered our frontline clinicians. The National Health Service is the largest employer of professionals on the planet. 1.4 million people are employed by our health service. And I spoke about how we've set up an entrepreneurial training program to allow our frontline clinicians who come up with a great idea but don't know how to develop it commercially and take that forward. And if we want to make things viable, we have to spin them out into an enterprise. That could be a commercial enterprise, but it could be a social enterprise or a charitable enterprise, that's fine. But we weren't helping support our clinicians develop the skills, knowledge and experience they needed to do that. Well, 4 years ago we launched our program. It has now become the world's largest entrepreneurial training program in healthcare. This year we have over 506 frontline clinicians on our program. Wow. In the first 3 years, they raised £164 million, created 175 startups, and impacted over 17 million patients and professionals through their innovations. How amazing is that? Just giving frontline clinicians permission to be entrepreneurs and support, wow, what they've been able to do and go away with. So there's so much technology going out there at the moment, isn't there? And it's difficult to know what to adopt. So I also set out how our nation is looking to use testbeds, kind of almost a sandbox where people can test and trial things, utilising data, utilising technology, but all in a safe, appropriate governance in place, making sure patient safety is at the heart of things. So I don't think we should shoot down things in flames before we've tested and trialled them appropriately, but I also don't think we should be introducing things rapidly that haven't gone through the same stringent process that we demand for other things, particularly in the pharmacology industry. So we need something similar, and we're making roads into that for regulating apps, for artificial intelligence systems, and I outlined in my speech talking about our code of conduct that we've put forward for people who want to develop artificial intelligence, talking about our NHS UK AI lab, £250 million of funding, going live very soon. We want people from across the world who've got some ideas in artificial intelligence and healthcare to come and bid for some of that money, and we will help. You will get some funding, you will get support, we will help you test and trial it and see if we can really help solve some of the grand problems in healthcare working together.